Because in Massachusetts, they are not guidelines. Both the CDC and OSHA in Massachusetts, their guidelines are actually laws.
In Massachusetts, are CDC guidelines, and if they're guidelines, do I have to follow them?
Funny you should say that, because in Massachusetts, they are not guidelines. Both the CDC and OSHA in Massachusetts, their guidelines are actually laws. So they are the minimal amount that you have to do and have to follow. So that creates a ton of confusion around here, is everyone reads it as guidelines and recommendations, and they're not. So do your guidelines, do your laws, and then if you're not, then you're potentially putting your office at risk for an inspection, and if they come in, then some sort of violation. So not guidelines.
A recent big fine in Massachusetts was about this, wasn't it?
Yeah, so from my understanding is they were not following the proper CDC and OSHA guidelines, and you have to do it. There's certain things that, and this isn't COVID, this is always. COVID has added a couple extra, basically PPE stuff, but the guidelines have always been the same, and I don't think they're going anywhere for right now. You got to do it. So if you're not doing it, you're not, following the dental board of what they say to do.
And that's who comes knocking. It's either the dental board or OSHA, right?
Yeah. And they might not come knocking. They might come, Zooming now.
Oh, I didn't know that.
I just made that up. Sorry.